Bonjour à tous.
Good morning, everyone.
A lot of people, it's not just today that feels like Groundhog Day, it's the whole past year. Not only are days in quarantine repeating themselves, but we're also wondering just how long this winter is going to last. If you're tired and overwhelmed, that's understandable. The past 12 months have been really hard. Maybe your kids are doing school from the kitchen table, or your parents are in a senior's home, or your business has had to close temporarily, perhaps repeatedly. No one expects this pandemic to end overnight, but you're probably looking for signs that things will get just a little bit easier. Well, this weekend, we passed an important milestone. It's now been 3 weeks with COVID-19 cases consistently falling across the country. This is because of the choices people have made to keep each other safe. It's because across the country, people are stepping up to do the right thing. Your actions are making a difference, but we can't let our guard down now. Doubling down is how we'll see even fewer people get sick and how we'll save lives. But remember, this is for now. This is not forever. We're very much on track to get everyone who wants a vaccine vaccinated by September. Déjà,
Already, over 1.1 million vaccine doses have been delivered to the provinces and territories, and nearly 87% of these doses have been administered. The most vulnerable people are receiving vaccines that could save their lives, particularly frontline workers and residents of long-term care facilities. And because we are currently receiving all of our Pfizer and Moderna orders that are anticipated until the end of March, millions have received their doses by then, and millions of others will be vaccinated in the spring.
Until every Canadian who wants a vaccine has received one. Now, this is no small task, and we knew there would be some hurdles along the way with unpredictability and increased demand for production. That's why we created a smart, proactive plan on vaccines and vaccine rollout. It's why we secured as many options as possible with hundreds of millions of doses from companies around the world. And it's why we invested in vaccine development and manufacturing here at home. And on that front, I have good news to share. 2 companies, Precision Nanosystems and Novavax, are now on track to manufacture vaccines right here in Canada. This is a major step forward to get vaccines made in Canada for Canadians. To begin with, we've signed a memorandum of understanding with Novavax to produce their COVID-19 vaccines at the new NRC Royalmount facility in Montreal. Pending Health Canada approval, tens of millions of Novavax COVID-19 doses will be made right here at home.
In September, I visited the site of the new facilities of the Therapeutics Research Centre on Royalmount Avenue in Montreal, where tens of millions of doses of the Novavax vaccine will be produced. Thanks to our funding, they accelerated construction, and all work should be finished by the end of the year. Once the facilities have been certified, they will be able to produce some 2 million doses of vaccines of all types every month.
As much domestic capacity for vaccine production as possible. That's why we've already invested $46 million in the vaccine development facility at the University of Saskatchewan's Vaccine and Infectious Disease Organization. The good news we've just heard is that Vido Intervac now projects they will be able to produce up to 40 million doses annually. We are investing in Canada's biomanufacturing sector for today and for the long term. En plus du travail.
In addition to the work underway in Montreal and Saskatoon, thanks to a federal investment of $25 million, Precision Nanosystems in Vancouver will also build a production facility capable of producing up to 240 million vaccine doses yearly. Over the past 5 years, our government has been investing in Canadian science and know-how. Supporting research and fabrication in Canada is a win on all fronts. We are protecting people today, and we are supporting good jobs for many years to come.
Vaccines work. They are safe and effective. When it's my turn, I'll be ready to roll up my sleeve and get my doses. These vaccines save lives, so I hope you'll join me. As part of our rollout plan, we're investing $64 million to make sure you know when and where to get vaccinated, the many safety measures in place, and why it's such a good idea to get your shot. No one who wants a vaccine will be left behind. No community will miss out. Just yesterday, the Canadian Rangers and members of the Canadian Armed Forces began working alongside Orange in Ontario. They're currently supporting vaccinations in the first 8 of 32 priority communities of the APTN Nation. In many cases, these Rangers are helping out in their own communities to ensure that everyone has the support they need. No matter where you are, if you want a vaccine, we'll make sure you get one.
Our number one priority is to protect you and your family. While we are working to ensure that vaccines are delivered and administered, we are also investing in treatments and testing. We have allocated $14 million to the development of a COVID-19 treatment by Odessa Biotech in Markham in Ontario. This treatment could save the lives of those who are most seriously infected with COVID-19. In addition to other promising treatments developed in Canada, notably that by Arch Biopartners, it will be a tool that we can use. Concerning testing, we have already sent over 17 million rapid tests to the provinces and territories. However, to date, only slightly more than 3 million of them have been used. I therefore encourage the provinces to continue to make good use of them. These tests must be used, whether it's in schools, long-term care facilities, or workplaces. They are essential for keeping the number of cases as low as possible, and they will be extremely important in the weeks and months to come to keep our numbers low until vaccines arrive in March. To ensure that these tests make it to the people who need them, we are now working directly with the private sector. Jointly with the provinces and territories, our government is working with CDL Rapid Screening Consortium, which groups together a number of businesses to deploy tests in workplaces. The goal of the consortium is to ensure the safety of workplaces, and that is also our priority. Thanks to rapid testing, people who cannot work at home have the possibility of testing and additional protection. As many specialists have said, large-scale distribution of rapid testing can truly help us contain the number of cases. We are doing what is necessary to protect people at work and rein in the number of cases for all others.
On treatments, on testing. Our top priority is making sure you and your family get through this crisis. But we can't do this alone. So when you wear a mask, when you keep your distance, when you stay at home, when you avoid gatherings, you're helping to save lives. So keep it up. We have to stay strong a little longer, but I know we're all up to the challenge. After all, the story of Canada is of people who never gave up, who never stop striving for a better tomorrow. That's something I was reminded of yesterday when I was at a virtual event with the first Black NHLer, Willie O'Ree, and some of the many young people he has inspired. From coast to coast to coast, Black Canadians have shaped our country. The reality is, though, that their stories are far too often ones of hard-won victories through adversity. The difficult truth is this: anti-Black racism, systemic discrimination, and unconscious bias still exist in Canada, and that has to change. As we rebuild from this pandemic, this is our time to act. This is our time to end injustices and inequalities and create a better, stronger country for everyone. L'année dernière, on a
concrete measures to better equip Black communities across the country. In particular, we launched the very first Black entrepreneurship program in Canada, and we pursued the implementation of our anti-racism strategy. We know that there is still a lot to do. We must eliminate systemic inequalities in our justice system, for example. As Black History Month kicks off, we must all be aware that it's not only an opportunity for us to reflect on the accomplishments of Black Canadians, but also to join them in their efforts to build a better and stronger country.
Today, I want to give everyone a quick update on our work with the new American administration. Yesterday, I had a very productive call with Vice President Harris. We discussed shared priorities on everything from fighting this pandemic and creating good jobs to addressing climate change and strengthening our trading relationship. Canadians and Americans have long stood together, not just as neighbors and allies, but as friends. I'm looking forward to working with both Vice President Harris and President Biden as we tackle these challenges and opportunities. Merci beaucoup.
Thank you very much.
Merci, Monsieur le Premier ministre. On va commencer la période de questions avec le téléphone aujourd'hui. Une question, une sous-question. One follow-up. Opérateur, c'est à vous.
Thank you. Merci. Première question. Catherine Lévesque, La Presse canadienne, à vous.
Question. Yes, good morning, Mr. Trudeau. Can you please explain to us why it's not possible to produce Pfizer and Moderna back here in Canada? Is there a clause in the contract that prevents this? Since the beginning, we've been working with vaccine companies, all of them, to try to encourage or develop production capacities here in Canada. We have worked with all of the companies. We are happy to announce a partnership with Novavax, and we will continue to work with various companies on that issue. In follow-up, Catherine? Question. Yes, does that mean that we are entitled to a clear number of Pfizer Moderna vaccines? And concerning travel, are you considering changes to the restrictions announced last week, for example, for humanitarian workers? Answer. The measures that we established are there to protect Canadians. I know that the vast majority of Canadians know very well that it is not the time to take vacations to the south. And obviously, we have taken very strong measures established to protect people from viruses being imported, and particularly new variants to Canada. There is always a place for rare exceptions for compassionate or humanitarian measures, but in general, the rules are there to be followed.
Measures to keep Canadians safe. That is something that has driven us since the very beginning of this pandemic. Do whatever is necessary to keep Canadians safe. That's why we brought in, as of almost a year ago, some of the strongest measures on a 2-week quarantine, on banning foreign travelers, and more recently on mandatory pre-boarding testing before coming home. The measures that we announced most recently on mandatory testing and 2 or 3 day quarantine or 3-day quarantine on arrival are designed to keep Canadians safe. Obviously, there may be particular compassionate or humanitarian exceptions that must be made in given situations, and we'll look at those. But our focus is on every situation, doing what is necessary to make sure we're keeping Canadians safe from importation of the virus and its variants.
Thank you. Operator, next question on the phone.
Thank you. Merci. Next question, Mary Kay Walsh, The Globe and Mail. Line open.
Good morning, Prime Minister. Thanks for taking our questions. I'm just wondering if you can explain what role the Novavax vaccine will play at all in Canada's actual vaccine plan. If production will start at the end of the summer with 2 million per month, does that not come after Canada is expecting to complete vaccinating all Canadians by September?
Our vaccines was to sign as many different contracts with as many different producers, potential producers of vaccines as possible. And that's what we did. And that's one of the reasons why we are now seeing many different vaccines coming to Canada. We're able to source and ensure that we're able to confidently say that not only will we get 3 million Canadians vaccinated by the end of March, we will have everyone who needs to be vaccinated by September. And we all hope that that is all that we're going to need. But as we see new variants rising, as we see a virus that will continue to be present in many places around the world, we don't know what the future looks like for a year from now, 2 years from now, 3 years from now. What we're very clear on is Canada will be developing domestic manufacturing. So regardless of what could happen in the future, we will have domestic production on top of all our partnerships and contracts signed with companies around the world. Je pense que
I think that people understand why it's important to sign a large number of varied contracts with various companies that produce vaccines to ensure that regardless of the companies that discover the best vaccines quickly, Canadians are well served. That's how we developed our portfolio, and it's working very well because we can still say that we will vaccinate millions of Canadians by the end of March, and we are still fully on track to vaccinate all the Canadians who wish it by the end of September. But obviously, we don't know what may happen next year or in the years to come. There are new variants. There will still be COVID-19 all around the world, even if Canada is able to vaccinate everyone. We don't know if we'll need follow-ups or new vaccines next year. So Canada will now be well placed to produce vaccines for Canadians at home. And obviously, in the best case scenario, if we don't need it here in Canada, we will be able to offer it to our allies or partners in developing countries around the world, because this virus isn't over until everyone has been vaccinated.
Yeah, thank you. So you're saying that this Novavax vaccine will be for future variants or future waves. And can you also please clarify or provide more specificity on the exact timeline for when you expect production will start? In your comments in French, you said the end of the summer. Does that mean August production or September production?
Obviously, we know that standing up domestic production capacity is the right thing to do. We need to restore our capacity in our pharmaceutical industry in Canada to supply vaccines to Canadians, whether it's for further waves of this virus or it's for future viruses. Canada has made a commitment to ensure that we have both the scientific and the production capacity to meet the needs of Canadians, regardless of what the future is. So that's part of what we're doing and why we're so pleased to be moving forward with Novavax. In regards to specific timelines, I think the ministers who are up after me will be able to speak more to it, but my understanding is the production facility should be completed this summer, and once certification is made, we should then be able to start producing the vaccines here in Canada reasonably quickly after that. But for better timelines, you can ask the ministers.
Merci. On va prendre une dernière question au téléphone avant de...
Thanks. We'll take one last question before we turn to the room. Operator.
Thank you, merci. Prochaine question, Raymond Fillon, TVA, à vous.
Merci.
Question. Good morning, Mr. Prime Minister. When you were elected over 4 years before the beginning of the pandemic, do you regret not building these facilities to establish domestic capacity earlier? Because then we would have had them and we would be able to produce vaccines now. Answer. I think that the entire planet was caught off guard by this pandemic, and I think that there are many lessons to be drawn from it, and that is why we are investing now in production capacity here in Canada. But I also want to highlight that the investments that we have made in the last 4 or 5 years in science, in research, after years of neglect, by the previous government have yielded fruit. They have allowed us to find solutions like we saw in Saskatoon, like we saw in Vancouver, and with Medicago. We were able to create an ecosystem, a scientific ecosystem over our years in power that has better placed us than we would have been otherwise. Of course, there are things that we might have wished to do faster, and that is why we are fixing things now so that Canada, regardless of the government in the decades to come, will have the ability to respond to this type of crisis. Follow-up? I would like to come back to the travel measures announced last week. Do you have a more precise date for implementation? Will they be implemented before mid-February? And once they are, will they be raised May 1st? Answer, we can take nothing for granted. We will keep the measures in place as long as needed to ensure the safety of Canadians. Since the fall, for months and months now, we have been saying to Canadians to not travel, to not leave the country, because we could not predict either the trajectory of the virus or the measures that we would be taking. So I understand people who are in a difficult situation, but we have said very clearly that we would establish measures to ensure the protection of Canadians, that there could be very little notice on the measures implemented, and concerning mandatory testing and the 3-day quarantine in hotels, we hope to have that implemented within the weeks to come. But people are working very hard to create a system so that it is established before people start traveling for the March break.
TV National News. Now, the UK has vaccinated about 14% of its population. Canada's at 2.5%. The UK, similar to Canada, at the beginning of this pandemic, had next to no domestic production capacity for vaccines. So the UK ramped up, Canada did not. Why is Canada lagging behind?
I think there are countries around the world that work extremely hard to develop their scientific capacities, to expand their manufacturing. I'm very pleased. I was very pleased last September to announce investments in the Royal Mount facility that's going to lead us to having vaccine production capacity as of this coming summer. There's always more that we can do, but there's always going to be ways to draw on lessons learned and inspiration from other countries, although I will highlight that in terms of models, we recognize that the UK is seeing a much higher rate of infection and course of the disease than we are facing here in Canada. So there's some things that they might like to be more like Canada on, and other things we're certainly going to learn from them.
But could your government have done more? Could you have done more for domestic capacity?
As we demonstrated, we worked extremely hard to draw in investments, to make investments necessary to develop domestic capacity. And that's something that we're continuing to work on. We are going to have domestic capacity after this summer. And in the meantime, we have secured contracts with enough different vaccine makers from around the world to make sure that Canadians are going to get vaccines quickly. We are going to hit our targets for the end of March, and we're also going to ensure that all Canadians who want a vaccine will get vaccinated by September. That's a commitment we are able to make because we had an extremely ambitious and extremely robust plan to both sign contracts with potential vaccine makers, assure doses for Canadians, more doses per capita than just about any other country, at the same time investing in domestic production capacity to make sure that in any future iteration of this pandemic or future pandemics, we will be prepared. Je peux rassurer les Canadiens.
I'd like to reassure Canadians that we have taken the necessary measures to vaccinate the largest number of Canadians as quickly as possible. We have signed contracts with many companies for more doses per person than any other country in the world, and that ensures that not only will we reach our target of 1 million people vaccinated by the end of March, but we will be able to vaccinate everyone who wishes it by September. In addition to this, last year we started to invest in domestic vaccine production capacity because we know that COVID-19 or other pandemics that may arise in the years to come, we need to be ready to respond.
Benchfield, Canadian Press. On the EU export restrictions, are they what are they meant for? Other than to are they meant to protect Europe's supply? Are they meant to keep these drugs out of Canada? And we have a free trade deal with the European Union. What good is that?
In my conversations with the EU Commission President, Ursula von der Leyen, she highlighted the need for greater transparency on vaccine production to make sure that things are being fair. They expressed certain concerns around AstraZeneca and Great Britain, for example, that is preoccupying Europe, but I'll allow the Europeans to talk a little bit more about that if they get asked. Our focus is on ensuring with Pfizer and with the Moderna in particular, continue to be respected. And the assurances that I've received, the assurances that this government has received, is that these transparency measures will not interfere with shipments destined for Canada.
Do you have that in writing?
International affairs and agreements between nations are based an awful lot on firm commitments made in conversations and shared publicly. It's not like a small claims court where you can show a document. The conversations I had with the President of the European Commission were enough to reassure me and should be enough to reassure all Canadians that the European Union is extremely mindful that Canada's contracts be respected, our supply of vaccines not be interfered with.
David Aiken, Global News. Today's announcement about domestic vaccine manufacturers comes, within hours of your trade minister issuing press release assuring us we're going to get this stuff. Nothing is written down, yet we have lots of stuff written down in trade agreements that the EU is not going to break its word. Why can't we get Canada on that list of countries that are exempted? Why can't you get something in writing? Why haven't you asked for something in writing?
In the spring, we made a decision that standing up domestic production of PPE was the right thing to do, regardless of whether or not we were confident we were going to continue to be receiving PPE from countries around the world. We knew that standing up domestic capacity was just the smart thing to do, not just for the short term, but to build the kind of resilience and jobs and opportunity that Canada needed through this pandemic. Similarly on vaccines, even though we have strong assurances from the European Union that the measures, the transparency measures they're bringing in will not affect Canada's supply, it is only responsible and right for Canada to be investing as well in our domestic biomanufacturing capacity, and that's exactly what we're doing. Ce printemps,
Last spring, when we had a lot of concerns about procurement of personal protective equipment, we decided to create domestic production capacity, even if we were increasingly certain that we would be able to receive millions or even billions of pieces of PPE. From overseas, we knew that we needed to create domestic capacity, and manufacturers and Canadian companies were very ready to contribute to help Canadians across the country, and that was a good thing for Canada. Similarly, even if we have contracts that we know will be respected, we are working collaboratively with our allies around the world, particularly in Europe. We know that it's a good thing also to invest in our domestic biopharmaceutical capacity here in Canada. question. I'd like to come back to the exemptions that your government is studying for the new rules for people returning to the country. I would like to give you a couple of examples. Someone who must go overseas because they have a dying loved one. They must go overseas to go for medical treatment, for example. In your eyes, is it acceptable for this person to pay $2,000 upon the return? Answer. Since the very beginning, we've had extremely strict rules on quarantine, on non-essential travel bans. We are going to continue to ensure that we protect Canadians. We can generate all sorts of cases, and our MPs and our CBSA staff have seen some concerning issues, and that's why we created exceptions in the fall to allow people to see more families reunited despite the restrictions that we applied. We implemented these mandatory quarantine measures in place to ensure the protection of Canadians. We will always be open to hearing the concerns that people have or exceptions, but I would highlight that the basic idea is that it's not the time to travel. And since the very beginning of the pandemic, people have missed funerals of loved ones. They've missed weddings or things that have been held virtually. It's very difficult for many people, and it will continue to be difficult for many. This pandemic is difficult, but our responsibility as a government is to do everything that is necessary to prevent more people from being infected, to prevent more people of dying uselessly or needlessly. And that is why we are adopting robust measures at the border. If there are extreme cases, we might be able to make exceptions, but even in so doing, on a case-by-case basis, we will not imperil Canadians.
Anytime we're bringing in sweeping measures at the border to protect Canadians, as we've seen, there are stories of heartbreak, of difficulties, but we have emphasized now is not the time to be traveling. And since the beginning of this pandemic, there have been stories of funerals that haven't been able to be held, weddings had to put off or done by Zoom, families not being able to get together. There have been really difficult and heartbreaking moments through this pandemic. And unfortunately, with these new measures, I'm certain there will be more difficult situations, and our hearts go out to people. But at the same time, our responsibility is to make sure we're keeping Canadians as safe as possible. These new variants out there are of real concern. So even if we do look at, or the minister does look at specific exceptions for compassionate, exceptional cases, I can tell you that our focus on making sure we're keeping Canadians safe from importations of this virus and of new variants is going to remain steadfast.
Hi, Prime Minister Tom Perry, CBC. Given this vaccine nationalism that we're seeing, should our goal be to make Canada self-sufficient when it comes to vaccines? And just, you were asked this earlier in French, on the Pfizer and Moderna vaccines, are we not making them here in Canada because we don't have the technology, or just because the companies don't want to make them here?
I think different companies will follow different strategies as they move forward. We have certainly been working with vaccine producers around the world to encourage them to set up manufacturing facilities in Canada, both in the short term for this, but in the longer term as well, to restore our biomanufacturing capacity domestically. This is something that we're going to continue working on. We have good news today with Novavax. We're looking forward to sharing more good news on investments in biopharmaceuticals in the coming months and years. I think it's going to be important that Canada be self-sufficient, but we're also a trading nation that understands that good, solid trading relationships with countries around the world are also a way of keeping Canadians properly supported and flourishing.
Merci, c'est ce qui met fin à la conférence de presse d'aujourd'hui.
Thank you. That ends the press conference today.